Hello and welcome to the Medical Sales Podcast, and I am your host, Samuel. In this podcast, I interview top medical sales reps and leading medical sales executives across the entire country. And it doesn't matter what medical sales industry, from medical device to pharmaceutical to genetic testing to diagnostic lab, you name it. You will learn how to either break into the industry, be a top 5% performer within your role in sales, or climb the corporate ladder. Welcome to the Medical Sales Podcast. Hello and welcome to the Medical Sales Podcast. I am your host, Samuel. And this week we have with us a special guest that goes by the name of Dr. Vinod Dasa. He is a LinkedIn influencer, orthopedic surgeon, and someone that truly cares about the disparities and the things healthcare lacks. In this episode, we get into social media and its impact on healthcare from multiple perspectives, from the healthcare provider perspective, and how it's affected how practices are run, how it's affected Dr. Vinod Dasa in his career, what it's enhanced, what it's changed, what it's helped him focus on, what it's allowed him to champion, and also how medical sales professionals interact with providers on social media, what's really received, what's appreciated, and where is it all really headed. This is an episode that's for the medical sales professional, for the medical sales professional leader, and for the medical provider. Whether you be a doctor, nurse, a surgeon, or another position within healthcare that has anything to do with providing care to patients. As always, we do our best to bring you episodes that bring you interesting insights into the industry from all perspectives, and I really do hope you enjoy this interview. How are we doing, Dr. Dasa? How's your day going today?
I'm doing well, thanks.
All right. For our listeners out there, you know what? I'm going to go ahead and let you introduce yourself, Dr. Dasa. Go ahead.
Sure. So my name is Dr. Dasa. I'm an orthopedic surgeon. I'm vice chair of orthopedics at LSU in New Orleans. I'm also the director of research here for our department. My clinical area of focus is around adult knee, so sports and adult reconstruction, and then pretty much everything in between. And then have some entrepreneurial ventures that I'm working on, do a fair amount of research around health disparities and inequities. So we've got a lot of work in that space. So kind of a broad range of areas.
Excellent. And we'll get into some of that. But, you know, what I really want to know right now, you know, you utilize LinkedIn quite a bit.
Yeah.
That's one of your big platforms. You're on there. You have a very good presence. Talk to us a little bit about what a platform like LinkedIn is doing for healthcare from your perspective.
So I'll tell you, especially from the physician's perspective, no one really heard our voice up until I think social media, right? Because when anyone thought about healthcare, everyone knew that physicians obviously were important to this, but we never really had an opportunity to say anything because everything was through the AMA or through our specialty organization. And so at an individual level, at a person in the trenches level, you never really understood kind of how we thought and what the challenges were from our perspective.
Sure.
And I think social media has really fundamentally changed kind of who's allowed to speak and how that gets interpreted and from whose perspective information is given. So I think the ability for people in the trenches doing the day-to-day work to be able to share our experience and share our perspective on healthcare and what we like about it, what we don't like about it, where we think it should change, you know, from our day-to-day kind of experiences, I think is important. And that's what I've seen happen with social media, the ability to democratize this space, this knowledge sharing that we've never had before.
Sure.
And, you know, and we recently published this paper around the transition from a KOL to a DOL, right? A key opinion leader, which was someone who was at a research meeting that was on the podium, and everyone was listening to them because they did the research and they were kind of the authority in a space. They had the kind of research credentials to be there. Right. So this concept called a DOL, which is a digital opinion leader, where it's not necessarily someone from the ivory tower on the podium at a conference. It can now be, you know, the person that just gets it, that's in the middle of, I don't know, the middle of Arkansas, that's a busy private practice person that doesn't have time to do research or talk at a national conference. Sure. And they're giving their opinion, and they're now giving really important information that's resonating with a lot of people. All of a sudden now they're at center stage.
Right.
right?
Right.
So social media, I think, has given the ability to democratize who we consider an expert, what information we think is appropriate. Let the community decide, not just some random person who thinks they're important decide what's important.
Okay, so for your experience, and I love that by the way, for your experience, what is that translated into? What was your experience before this opportunity with social media like LinkedIn, and what is your experience now? What's different
Yeah,
for
so
you?
before, I just put my head down and went to work, and I didn't really have any big aspirations to be on a stage or to be noticed. But I was
Sure.
just definitely frustrated with healthcare, just like everybody else, whether it's EMR or decreasing reimbursements and all this stuff. And healthcare's changing. And so beforehand, just kind of sucked it up, and there wasn't anything for me to do about it, right? Because I didn't plan on being elected to some president of anything. So I was just
Sure.
kind of, all right, this is just the way it is, and we just move on. But as social media has grown, you start realizing, no, actually, you can have a voice, you can make a difference. And so that's what's really changed for me, is realizing, who am I, right? I mean, before I started getting involved with LinkedIn, or even now, like, who am I? I mean, I'm just giving my perspective and giving my opinion about
Hmm.
what I see and what I think works and doesn't work and those kinds of things, and it's resonating with people. And it's not that I'm saying I'm right or I'm wrong. I'm just putting what I think out there, and I think the community is deciding, you know, what it means and what's right and what's wrong, or the path forward. And I think it's just given a voice to people who previously probably thought they were voiceless.
Sure.
Um, where you don't need to have the connections, you don't need to have the pedigree, you don't need to have the network, right?
Right.
And have the right business cards in order to make a difference. It's no. I mean, if you've got something to say and it makes sense, it allows people to have a voice and not have to be part of that kind of old guard, the old boys club.
Yeah, yeah, yeah. So I imagine that probably changes your career trajectory a bit, right? Because it's exposed you to opportunities you didn't know about. And I'd like to believe that that might change the way you're practicing now. Would you say it takes it that far?
Yeah, no, I think you're dead on, because I'll tell you the other thing that I've learned from social media is I'm getting access to information that I would have to wait for a year until I go to a meeting to learn
Right,
about, right?
right. Yeah,
So I'm
yeah.
seeing people use innovative tools or innovative solutions, or a new drug a new way, or whatever. They're seeing I saw someone post something about it, a novel way to examine a patient,
Right,
right?
right.
I mean, how else would I have gotten that information,
Yeah,
other than go to a national meeting and hoping I stumble upon it, or it's in a research article, and I'm not sifting through all of that. So it's opened up a lot of doors intellectually, experientially, I think from a business perspective. It's a way to connect with people that I never in a million years could have ever imagined, that I would be
okay.
meeting people from around the world, all different walks of life, different companies, different industries, um, where you develop a digital relationship, really, with people
Right,
and with companies. So it's really
right.
fascinating to see how this is
So,
evolving.
yeah, no, I mean, you nailed it with how much has changed. And when you think about developing relationships, as you know, you're on the Medical Sales Podcast. A lot of medical sales professionals are listening right now. How 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 do you receive medical sales professionals that you've gotten to know through the LinkedIn platform, as
You know,
opposed to the way you used to interact with them?
Yeah, so when I used to interact, and I'm learning about how the medical sales process works, and everybody's trying to fight Susie at my front desk to be able to get to me in my office, and all
Right,
that stuff, right? So
right.
knowing that it's getting harder and harder to get my attention, then you have to go where I am, right? You can't,
Yeah,
and if you still think it's 1980, fee for service playbook, then good luck to you. I mean, this is the new world, and so you've got to have a modern playbook. And I give it another example, right? When I go to a national meeting, they're still sliding paper flyers under my hotel door. I mean, it's 2022, and you think that's
right,
how you engage physicians, is sliding a
right,
piece of glossy paper, right?
right,
And there's no digital engagement, but yet everyone's digital, right? So I agree with you. I think this is the space, this is where you need to be, because that's where physicians are growing. And so then the other thing is segment the physicians that you're working with. Obviously, you got the older physicians who
mm,
may be not as tech savvy or interested in this, the cranky people that are just like, this social thing is for my high school teenagers or whatever, right?
right,
You've got that group, and that's not, and you're not going to magically change them, right? So you've got a group of physicians and providers you got to call on, and you got to go old school, which is fine. But then you have to recognize that there's a spectrum now, and as you get younger and younger, you're going to expect or have to deal with physicians or providers that are more digital and consume information in a bunch of different ways, not just the flyer under your hotel door, right? And so you're going to have to adjust and customize based. So you need to know who your customer is, right? You've got to understand who you're talking to, and what resonates with them. And so maybe it's digital for the younger folks, maybe it's not for the older folks, or whatever. Maybe there's some, and so I think it's not going to be a one size fits all approach. You've got to kind of feel out and understand kind of what's what, because again, it's going to be harder and harder to engage me one-on-one in person, because as reimbursements go down and we switch this value-based world and all that, my time is getting less and less available because I got to see more patients. Right. There's only one direction this goes. As reimbursements go down, I got to see more patients. If I'm seeing more patients, guess what? I don't have 45 minutes to spend with you if you're able to get past my front desk. So you got to be concise. It's got to be to the point. It's got to be, there's a reason Twitter is exploding, right? So think about that. It's concise, get to the point information, and you got to be on your game. You got to understand what it is. And you may have a talk track and a talking point that's way off base for me, right? You may have a product. I actually like this part of it, not this part, but you're talking about that part. And you're talking about it and wasting your time. And so you have to really, like I said, understand your customer. What are their pain points? What are they looking for? And why do you solve those pain points?
I love it. Last thing I'll ask about this topic. When you see, just like you said, everyone's trying to bide for your time, including medical sales reps on the LinkedIn platform or Twitter. Does it resonate with you when you see a sales rep that has a brand? I mean, they've really established themselves on the platform. Maybe they're connected to a lot of your colleagues and they're giving opinions. Or are you kind of receptive to anyone that hits you up with a message and you just give them a little bit of time? How do you see it?
Yeah, so as you would imagine, I get pummeled with direct messages on LinkedIn, so that's tough. I think what you need to do, and I've seen, so there was a post recently on what was it? There was a surgeon that posted an X-ray of an implant wearing out, and it was really crooked on the X-ray. And the reps for the company got on there and just started like spewing the brochure stuff out of the company's brochure. And I'm like, you just lost all credibility, right? You have an implant failure here, right? And all the surgeons that recognize that this implant failed, maybe it's a surgeon's fault. I completely understand. But to be completely tone deaf and say, amazing job, Dr. So-and-so, when the x-rays are really crooked or it's really bad, you lose a ton of credibility, right? And so I think you have to be authentic, you have to be genuine, but obviously you got your compliance issues. It's within the confines of what your company will allow you to say, but you've got to figure out how to thread that needle and bring value. So you start becoming recognized as an authority or someone that's worth listening to, as opposed to someone that's just gonna, spat out the and regurgitate
company messaging,
right?
Right.
Because it's easy enough for us to see through it. I mean, come on, like, who are you kidding, right? So, I mean, like, be sincere, be genuine. And there's ways of having a conversation where you can be critical or provide critique. You just have to be smart about it. You have to be, and so if you're looking to build your brand and build respect and credibility, then do it, right? I mean, don't just photocopy your brochure and stick it on there.
I love it. Okay, so we're talking about social media and we're talking about how it has an impact on medicine and what has changed. There's another side of this that I know that you deal with, and that's really bringing to the surface all the different health disparities that are going on, and how medicine is impacted. We talked a little bit earlier about how you have these third parties that rate how well a surgeon practices their craft and if there's someone you should go to or not, and it's a little interesting how they're coming to the conclusions on who's good and who's not. Why don't you talk to us a little bit about what you've seen in that?
Yeah, so I think one of the key factors for all the medical sales folks that are listening to this is this transition from a fee-for-service model to a value-based model, okay? So what we're doing is what we're moving is risk. We're shifting risk from the insurance company to basically me or the hospital. So as risk shifts, we've got to figure out who's at high risk, right? Because if I'm costing the hospital money, all of a sudden it's a complete 180. One day I was making them a ton of money, right, by doing a lot of cases. All of a sudden now they're losing money off of me. That's how do you lose money off a surgeon? That's like, just blows your mind.
Sure.
So if this is where healthcare is going and we're starting to accept more and more risk, then the folks listening need to understand what are the things that I'm going to start paying attention to as a provider, right? What are the things that's going to be important to me as I start making decisions about what product I use, how I use it, all those things. And so one of the challenges for me is, as risk shifts and people start looking at me and asking, am I a risky surgeon? Or am I a hospital or an insurance company? Am I willing to bet on Dr. Dasa? Right? We have to understand then what are my outcomes, right? As they start analyzing how I am as a surgeon, as we move away from fee for service. Well, then how do I perform as a surgeon? Well, that's a lot of it's linked to my patients, right? And so if my patients live, for example, in a food desert or have food insecurity, or 45% of my patients are non-white, and we know that there are differences in outcomes between white and non-white patients. So if I'm taking care of a huge percentage of patients that are non-white, that have food insecurity, live in a food desert, don't have transportation, let's face it, I'm in the Gulf South, right? It is not an equal playing field down here. So then what happens when I take care of these patients and their outcomes are not necessarily the same as those people from Beverly Hills or downtown Manhattan or Palo Alto, right? So if I'm going to be measured against those surgeons taking care of those patients, how does this become an equal playing field? And so as this happens, I think social media is a great place where we can start highlighting and bringing a lot of this information out in real time, right? I'm not waiting for CMS to analyze this for 6 months or 2 years and another company, or if you see a US News and World Report grading system about different health systems, take a step back and say, hey, does this really make sense? What patients are they taking care of? And the hospitals and physicians that didn't make the list, right? Are they truly not that good, or is the deck stacked against them? Right? Yeah. So, and those rating agencies and those companies don't necessarily have a really robust system to do what we call risk adjustment, right? And are they getting that level of detail? So you're starting to pick winners and losers. How? Why? Right? And so that's where I think social media can help, where we start highlighting some of these challenges that probably a lot of your listeners, a lot of folks don't realize. Because my fear is, as we go down this road, we marginalize patients that are already marginalized by picking on the hospitals and the physicians that are taking care of them and penalizing them. And so I think those things are important. So we're actively working on research and highlighting where these issues are and what are the differences are. We published a paper recently. I presented this paper at the Academy, the National Orthopedic Meeting. Guess how many randomized controlled trials? Randomized controlled trials. These are the best research papers, right? In the top tier orthopedic journals. JBJS, Core, these are the top-notch journals. Randomized controlled trials. So you choose what variables we're going to include in the research, right? Age, gender, BMI, whatever you want. These are prospective studies. How many included race or any other variable related to social determinants of health? 2017 to 2019. So this isn't like 1960, right? Martin Luther King. This is like now, today. How many prospective randomized controlled trials had any of those elements in their studies? Less than 10%.
Less than 10%. Wow.
Okay. So we are doing research. So you have 95% of those patients could have been white and wealthy.
Wow. Yeah.
Right?
Yeah.
So these are the challenges that we're facing. This is how healthcare is moving. And so you have to, from my perspective, this is one of the areas where I think social media really helps, where I can bring this information out and really highlight kind of where healthcare is going and do my part, right? I'm not going to be able to save the planet. I'm not going to cure world hunger.
No, but it can initiate change. It can initiate change.
So, and I bring it up, and maybe the right person sees it, it resonates with them, and something happens. I don't know, right? But you have to try. And so that's kind of my philosophy and how I think social media helps from a bunch of different angles, not just trying to create a brand or something like that.
Right, right. No, I love it. And you're bringing attention to this. Where can people find you and more of your information, Dr. Dasa?
Yeah, so on LinkedIn, I'm there. You can find me on Twitter. We've started a new social media and education platform called Doc Social, so doc.social. And there we're bringing all of healthcare together into a singular platform so we can all learn and teach each other. So a number of different ways.
Excellent. Well, Dr. Dasa, it's always a pleasure. Thank you for the time today.
All right, take care.
And that was Dr. Vinod Dasa. I really liked that interview because it was pretty cool to see someone so passionate about addressing the disparities within healthcare and really getting traction on such a public platform and uniting a whole other group of people that see the same issues and want to do something, all the way down to how clinical trials are run and making sure that the right patients are represented, making sure that the right institutions have the right support to provide all patient groups better care. You might be somebody out there that's a medical sales professional, or you want to be a medical sales professional, and you're listening to this and you're saying, how do I get part of this world? How do I get to be a part of this world? What do I need to do to create an opportunity or find an opportunity for myself to have a customer like Dr. Dasa and be able to step onto a platform like LinkedIn and contribute to the conversation and let your own voice be heard? That's not only supporting whatever it is you sell or what disease state you're working within, but your own ideas, your own passions around the industry. If that's you, if you're someone that wants to get into the industry and you're looking to become a medical sales professional, then I want you to go to evolveyoursuccess.com and select Attain Medical Sales Role. Follow the prompts and ultimately get in touch with someone from the Evolve Your Success team that will show you how you can make your dream of being a medical sales professional a reality. And for you medical professionals out there, a lot of medical sales professionals listen to the show and they're looking for ways to do business better. They're looking for ways to be more effective. They're looking for ways to get better access and provide more value to people like Dr. Vinod Dasa, or to different types of staff, or to nurses, or to PAs, or to a completely different disease state. It really doesn't matter. If it's within the healthcare space, you're a medical sales professional that's looking to provide more value. And if that's you, and if you're wanting something that can really take things to the next level, then I want you to visit evolveyoursuccess.com and select Improve Sales Performance. Follow the prompts, put in information, and get in touch with us and have a conversation around the things you can do to take your career to the next level, to take your numbers to the next level, to provide value to your customers that they've never seen before. That type of value where they remember your name and they think of you every time a certain type of patient walks in. As always, we do our best to bring you guests that give you insights into the medical sales industry, insights into healthcare, insights into the way healthcare is practiced from all perspectives, from the patient all the way to the provider. So make sure you tune in next week for another episode of the Medical Sales Podcast. I hope you enjoyed today's episode. And remember, I have a couple programs that show you exactly how to break into the medical sales industry, become a top-performing medical sales professional, and also how to masterfully navigate your career to executive level leadership. Check out these programs and learn more at evolveyoursuccess.com. Stay tuned for more awesome content with amazing interviews.